Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And we are back, and if you're joining us now, we're just jumping into our first conversation, and we are giving you our COVID-19 update, and here to discuss some information about what is going on with the virus is Dr. Jorge Hidalgo, who is an internist at the Belize Healthcare Partners. Good morning, doctor.
Good morning, and thank you for having me again.
Right, thank you for joining us.
Yeah.
So,
Pleasure.
we are discussing COVID-19, which is, of course, at the forefront of everybody's minds. And perhaps you can start by sharing some of the latest developments that we are hearing about the virus as, you know, we all continue to watch and monitor for updates.
Well, yes, well, first of all, we need to say that COVID-19, it continues the first enemy in the world at this point, as that's the words that the World Health Organization General President told us last week in his speech. No? Of course, we're still learning, and one of the things that we are also seeing is that each country is facing COVID-19 in their own way, meaning that the lack of solidarity, we can say the union of countries is seeing, for many reasons, but any country is essentially fighting the COVID-19 based on their own resources. And that's been impacted in many ways, because we can see that the division and there are no union among countries. Some of course, not every country, but we can see as probably one of the things we are learning is that in terms of vaccination or testing availability, like in West Africa, they essentially are lacking of that because, the high demand and also to buy testing machines and testing equipment. It's not like we are going to the supermarket. In those days, it is very controlled. You buy the machine, but they say they will sell you the reactive and all the different things based on allocations. The country is this size, and you are able to get this amount of testing, but we will send you in amount of two. Those things are being impacted. Many of us, and of course we are not separated from that reality.
Yeah.
But probably one of the most important things, and I believe everybody was happy to hear those news yesterday, is regarding the vaccines. And I think so probably we will talk a little bit on that in the sense that despite that the COVID-19 is impacting us, and also all of us are looking for what is happening with vaccines. Yesterday, we have two information. We have two vaccines that already went into phase 1 of the randomized controlled trials with animals. And then some, and after they passed the first phase of the randomized trial, that is this first phase were done in animals. Then they moved to the second phase, and that is in the Oxford group and also in Wuhan. Now, this is promising. Of course, we need to see it with cautious, but the Oxford group, they recruit 1,077 healthy adults, 50% male, but also 90.9% white in the age of 18 and 55. And they see more or less that the Oxford vaccine is generated more or less 90% of neutralizing antibodies that is promising. And then in this initial phase, they notice as a side effects, fever, tiredness, and also pain in the site of the injection as the most important side effects. That being that is, in a way, it seems promising. Then, of course, when they passed this phase yesterday, announced that they will move to the most important phase, that is the third phase, where they need to recruit a huge amount of people. Of course, this third phase, they will need to include a population with taking in consideration the race, the gender, mean a more robust amount of people, and also different population to be able to see, because of course, unfortunately, some medications can react different based on the race, based on your nationality, and different genetic particularities mean that in this phase 3, they need to include a most robust group of population with all these different components to be able to see that it's going to be effective. Of course, despite of that, we are not seeing that this is going to be happen immediately, because this phase 3 is more, we need to have more bigger population, but also we need to have a proper monitoring and act very cautious on that. No, as you can see, just with that promise, the UK government secure just in case it's like a bidding. No, they secure 30 millions of doses for one group and 60 millions of doses for other group. They are trying to secure themselves.
Yes.
Yes, and actually, going back to time, that was going to be my question, because you had earlier said that we were in phase 1 of that testing of that vaccine. So, just for our viewers, typically, how many phases are there, and how long does it take before it's available to the public if it is proven successful?
Yeah, the phases of a randomized trial. And when we're talking a randomized trial, is that we need to include it's a double-blind study. We compare with other type of vaccines in the sense that when we, as doctors, we are participating in those trials, we don't know what patient is getting what medication. That is what we call it a double-blinded study. No, the phase 1. It varies. No, it can take the total study. It can take until 18 months, including the phases, if everything goes well. No? Mean that the first phase they did in animals, like and then it's a small group of animals. Then the second phase we use a small group of human population with like in the UK they use 1,000
and healthy people.
Yes, needs to be healthy people. They have certain criteria. They need to be HIV negative, more than 18 years old, because of course we need to have a signed consent form, and everybody needs to know exactly what they are facing after they sign a very robust consent form for probably more than 20 pages, just for, of course, the liability and all those things, no?
Yeah.
Mean that they need to the different companies and the groups, they need to do that. And also it will vary with time to time. If we see immediately that the vaccine is not responding, sometimes we stop the trials immediately. We don't complete it.
Yes.
But in this case, they started in more or less in April, and it seems to take more an average of 3 months for the initial group that they observed during a period of 28 days to see if there's any side effects, if there's any reaction with the vaccine. And then in this initial study, and the Wuhan group as well as the Oxford group, both of them noticed as a side effects the pain in the local area, fever, and generalized fatigue. some of them were observed until 56 days, no? That to making sure that we are not having major side effects.
Yeah.
I mean that this is the first phase with animal that probably in this particular studies we are trying to in a way to speed it, and then the initial phase probably took a month or two, and then this phase took a little bit longer, and now the third phase, which I think so it's going to be the proven one, when they need to include a very robust amount of candidates from all over and also different races. That it will take a little bit longer. That's why we don't anticipate to have any news until probably the end of the year or the beginning of the year, new year.
I'm glad you said that, because what you explain is that the wait time is necessary. So moving into a new phase is always promising, but there is it's not about giving the vaccine and testing the following day. You need to wait a substantial amount of time to see what side effects, effectiveness, and things of that sort, right?
That's correct. And that's why even that these two initial phases are very promising, we need to go to this group that is going to include different ages, different races, women, males, and to see if we basically respond at the same. Because of course the Wuhan vaccine, the group they include was a little bit with the less people. No? I mean, of course the difference in ages. The group of Oxford, they include 18 to 55 years old, and the group of Wuhan, they include probably from 18 to 83 years old, a little bit more, include the elderly population as well. I mean, that's important, and then they notice more or less similarities in terms of 90 to 96% response in terms of when we talk about the immunity response and protection with the vaccine.
Yes.
You know, that's numbers are promising, but again, we need to see this phase 3 trial.
Another critical aspect for us, and I think you kind of alluded to it in one of your prior answers, is looking at the demographics or the race of the people who are currently being tested. So in the UK, it's Caucasians, and I'd assume in Asia, or in China, it's Asians. And for us, where we have a different biological makeup and mixed races, we need to know how effective these vaccines will be with people who share similarities in races, right?
That's why I'm saying this phase 3 study is very, and we are also eager to see what is going to happen, because of course we will include a much larger population. We need to include a different, as you mentioned, different. We need to include the Hispanic. We need to include the Black people. We need to include different races to see if the vaccine will respond similar to and then to see, okay, probably in the Caucasian population we see this amount of side effects, but in the American population we will see a different type of side effects, as well as the Asian. The population and each race, each age, the side effects probably will vary.
So, what we and I'm glad you had the time to have this conversation, because when we see a headline of a news story like we saw yesterday about the Oxford trials, it really made us very optimistic that the end may be sooner than we think. But that's just not the case.
Exactly. Again, the other important point is, despite that the vaccine and are promising, we need also to have in consideration a couple of things. One, the equity of the distribution of the vaccine. Mean that who is going to get it, what are going to be the criteria for a country to get it, is going to be sell as we are seeing right now with the testing in probably in certain amount for countries, depends on the population. That those things, like I say, they secure X amount vaccines. Yeah, and it's
If
like
I
a
could,
like a billion.
yeah, I do have a question about that because that's one of the things that we haven't discussed, at least I know locally, and that's access. There's a vaccine alliance. I know that the World Health Organization has worked to get countries on board on. So from my understanding, you can definitely clarify, it's that countries would agree that if there is a development of a vaccine that works, that there will be equitable distribution or access for people across the world. But not
Exactly.
all countries have signed up to this alliance.
That's an important thing, that and as mentioned in the beginning,
Yeah.
Is that the solidarity. So, each country we need to have basically became united and in this fight, But unfortunately, this is not the case. Each country is doing is basically battling his own fight,
Yeah.
as I mentioned at the beginning. The equitable distribution of the future COVID-19, it will require a detailed evaluation of local countries' needs and priorities, the community engagement, and trust, and of course, the global planning is underway, as you mentioned. I mean that is important. I'm not sure about what is our situation. Hopefully, we already are part of this group. I don't have that information.
But what we have seen, and I think, Belize is in the situation where we can only benefit from these types of alliances because we're not trying to create a vaccine at any lab here. So it's more important for us that we pay attention to who's developing and whether they're a part of the alliance or what their track record in these types of ventures are. I think you used the example of the UK, who currently, even though the vaccines are only promising, they're not approved as yet, already trying to secure for their population. And we also had this situation with remdesivir with the United States, where they bought up the global stock for 3 months when that started to look promising. So what does that say about the possibilities as we move forward when everybody across the globe is eagerly waiting for treatment or vaccines?
One of the things also we learned from the vaccine yesterday, as you know, probably you saw the news, is that also is a global alliance between France, Germany, and the U.S. companies in that fight, and of course they are also securing their own stock of vaccines. I mean that I believe that in this case we will need to have the intervention of the World Health Organization to making sure that it's going to be at least for low-income countries a reasonable distribution of vaccines, that we can secure X amount of vaccines based on the size of our population.
And until there's a vaccine and until it's able to be accessed by all of the countries and whoever who would be needing to get it, is there anything new that we're learning about COVID-19 in terms of the ways we can reduce perhaps contact and reduce the rate of infection as we go along? Because as we know, we've been, for the past few months, adhering to the measures such as physical distance and whatever. But have we learned anything about how the virus is transmitted? And are there any sort of new or developing recommendations as we go along until we wait for the vaccine?
Well, the main recommendations remain the same, and unfortunately, you can see easily going to a supermarket or going to walking people in the street and on other kind of area of stores. You can see that unfortunately we are not completely adhering. The population is not completely adhering to using the mask. As I told you the last time, using a mask now is like an etiquette and in a way to respect each other. I will use my mask because I want to protect you. Mean that I need to demand the same from you. If you are not wearing your mask, then in a way is a disrespectful, no? Because you are not protecting me. I'm trying to protect you, but you are not protecting me.
Yeah.
I mean that we need, as we are being really very lucky in Belize, the way we are, but I think so we cannot relax. We are essentially seeing what is going on in other countries, and we don't want Belize to be in the same problem. But of course, that's have many ramifications. No, of course, as a society, we have responsibility. The government needs to play also the part. I mean, it's a multi-sectorial and team effort, and all of us are in the same ship, and we need to work together. No, as we are also demanding, we also need to do, as a society, we need to play our part. And as you see, you asked me, there are something new developments, new medications. Unfortunately, there are a huge amount of clinical trials, not only for vaccines, but also for medication. But so far, there are nothing new that compared with what we discussed the other day. You know? Of course, there are new things, like we noticed that we are using other devices. Not everybody needs to go into a mechanical ventilator, because there are no, based on what we are learning down the road, we see that some other less invasive techniques we can help patients that are not too sick. No? Of course, we see that the 5% are those that end in an ICU. And in some areas, the mortality is still high, unfortunately, not only for the patients itself, but also the healthcare personnel are also dying because of COVID-19, and they acquire while they are working. You know, this is still very complex, and we are still learning. Even that we have a little bit more knowledge now than a few months ago. This is still very new.
And I know that definitely, as a critical care specialist, you've been paying attention to some of the treatment options that people are attempting. Since there is no confirmed treatment for COVID-19 as yet, there's a lot of trial and error and testing out current medication to see how effective they are in treatment. What do we know so far about things that may potentially help in treating COVID-19?
Yeah, in terms of, we can divide it in the three categories. No, the mild cases, those that are completely asymptomatic, probably are the most difficult, because we can probably have the virus with no symptoms, and then we are spreading. But also we have the mild cases that are testing and have probably some minimal symptoms, that essentially the most important thing is stay on quarantine, keeping your hydration, and Tylenol to control any pain or fever. No? As you probably see in some of our neighbor countries, they are offering, and the Ministry of Health are offering, like a kit of a variety of medication that you don't know what of the medication is going to help. And of course, this is not, and all the medication that are in that kit have proven that they are not working, but still, no, they're still using it, like the hydroxychloroquine. That countries are still using it, despite that when the clinical trials shown no response. But it's like you know, as a human beings, we need to have some certain kind of security and certain kind of comfort, and then people need to have something in hand to feel comfortable. But unfortunately, those kids, they are not with medication that are not that prove that are not working. And of course, there are no. We need to do a huge clinical trials to prove that we can use it as in the general population. this is complex. Unfortunately, it's as I mentioned, each country is doing their own thing and fighting their own battle in their own way.
Yeah, and since you spoke about other countries, I'm also curious to know a little bit about the numbers, just in general, because of course we know we've tracked, or people have been tracking this disease since we first heard reports about it coming out of Asia. Then Europe was the big epicenter, which then shifted to North America. And some people, or some are now saying that now Latin America is the next big, let's call it epicenter, with Brazil and Mexico and other countries becoming, having high rates. So can you speak to us a little bit about the numbers, where the trends are indicating, and, perhaps how long we're expecting that, the numbers are going to keep increasing this way?
Yeah, well, as you know, many of the things we are seeing, it basically are impacted because of the density of the population.
Yes.
You see, United States, of course, they are, in a way, they put down their own defenses because of the need of the economic situation to improve. No? I mean that in that sense, they essentially are, in a way, they relax the measures. No, of course, as you see in the U.S., even there is a country, you can see that each state is working in his different ways. It's not a unified situation. Brazil, Brazil is a super dense population, as well as India, who is becoming the third country now affected. Again, one more time mentioned is the density. We are blessed in the sense that we don't have that problem, and in a way, this is helping us, and I believe it will help a lot in the future. But again, we cannot relax. And of course, the mortality rate in those countries are higher because, of course, it's a higher population, and the health systems are different in terms of resources. Of course, India is facing right now the situation, and they are doing their own thing, but the way and the amount of resources, it will vary. That it's just that, and of course, locally we are not in that density situation. Our population is not that big, and that is helping us, is played an important role in the way we are.
Yeah. Doc, I wanted to get your opinion on the recent information that came out. There were a group of scientists that wrote to the World Health Organization saying that they have studied the new coronavirus, and that they believe it can be transmitted or is airborne in its transmission. And the World Health Organization right now said they acknowledge the emerging evidence. What are your thoughts when we see something like that as non-scientists? How should we interpret it?
Well, again, as we mentioned, and also you've seen, we are in a learning process. There are many things that are written every day, many information that we see in different social medias, as well as even the most recognized journals.
Yeah.
They are not essentially completing the properly peer review in some of the articles,
Yeah.
And then, as you can see, in some occasions, they need to retract it because they see that the evidence is different. Again, we know that the virus is airborne. What we don't know is the extension. We see, okay, let's keep this distancing, but we don't know, that we still not understand is how long it will remain in the air, and if we need to have an extra precaution. For now, as I mentioned, we need to be very cautious. We cannot relax ourselves. We need to wear our masks, but we need to wear our masks properly, as I mentioned and illustrate in the last session we have. Unfortunately, we are wearing our mask, but we are not doing it properly, you know? And that's also has an impact. In that we need to be very conscious about that, and about also the social distancing, the washing hands, and the things that you are showing in the screen that is critical.
Yeah.
That we as a population, we need to protect over each other, because unfortunately, until we don't have a vaccine, we will essentially be vulnerable.
And you know, and doctor, that brings up an important issue, I think, just to jump off of Marlene's question, and that's for our viewers and the general public. What is your advice to the public in terms of when they see information, how do they know what to trust? You know, what are good sources of information, what to follow, or what should they look for when they're reading something in order to trust that information? Because as we know, there's so much misinformation that's being spread about this virus from a variety of different places, whether it's online or even just by word of mouth. So what would you recommend to the general public to look out for in order to get the best information and to stay informed about what they should do in the pandemic?
Well, that is a very difficult question because, as mentioned, and you know, you guys are in the social media, and you see this tsunami, we can say tsunami of information and misinformation. No? And again, we're trying to see, okay, like I mentioned at the beginning, the kit that the other countries are doing, no? And then we say why we don't have the same kits, and we don't have the same kits because even that we are in a small country, I think so the authorities are very cautious about the medication. And again, when we see those kits that are distributed in our neighboring countries, they have no less than 9 medications. And it's like a bomb. No? They don't know exactly what is going to work. But again, as a human beings, we want to have certain security. And then if we have the kit, we say, okay, I already have my kit and I'm protected. But then what is happening with those kits is that we are facing some of the problems because of side effects of the medication. Yeah. Also, in some cases, there are some antibiotics. And what we are essentially promoting is bacterial resistance. No, meaning that in the future, probably you have a throat infection. Then if you are taking this amount of antibiotics, the common antibiotics are not going to work. Meaning that we need to be very cautious, and also we need to have also questioning information, especially for sources that we with low credibility. No.
Yes.
I mean that we need to double check and probably ask somebody, a doctor, friend, or somebody that it can help you to clarify questions that you have or information that you are reading, especially with different kind of medications that the people are trying to promote. And again, unfortunate also in this pandemic is also you know, the commercial part. No? There are people that are benefiting from all those things. No? I mean, we need to be very careful about the information we are having.
You know, Doc, I think you mentioned it a bit earlier that because we've been so blessed in what we have seen with COVID, we have containment for the most part. We've not had community spread for quite a while. I think naturally people just start to get a bit more relaxed. And as we see the data coming out, I know that there's still some people who are really cynical saying, well, you know, the fatality rate is low. But what we have seen as well is looking at where the research is showing the long-term effects of the disease and also how it can impact the younger population. Maybe not kill them, but create some very severe illness and long-term effects. Do you want to speak to that?
Yes, This is a good point. Let's say that 10% of the patients are going to be sick. From this 10%, probably 6 to 5% are going to end in the ICU. The patients that are going to end in ICU, they will last at minimum 2 to 3 weeks. And it doesn't mean that after 3 weeks, you are going to get out of the ICU, walk in and go back to your office next day. Unfortunately, this is not the case because the medication and the treatment we need to apply to them, it have an impact, and we call it the post-ICU syndrome. I mean that there are some patients that they can get really weak, they can have nightmares, they can have problems socializing at the very beginning, lack of concentration. I mean that it will take, in some patients, depends on comorbidities. And when I talk about comorbidities, I'm saying if it's a patient that is in ICU, but also have diabetes or have failure or have any other medical conditions associated that will also contribute into the recovery, and it can impact the length of stay in ICU. And that it will also, the length of stay in ICU will impact your incorporation to your normal life. Some of the most severe cases also ended with something that we call the pulmonary fibrosis. I mean that it will, some of the cases we are seeing that they are at the end of the admission to the ICU, they will depend on oxygen for an extended period of time. And if the case is really bad, they probably ended in using oxygen for the rest of their life. But of course, those are the things we are still learning. But for sure, we've seen that some severe cases, they ended with pulmonary fibrosis, that it requires oxygen for an extended period of time. I mean that it's very complex if you end in ICU, because and it's not based on resources. It's based on how the body is going to respond. Each patient responds in a different way, and again, also each one it will also depends on what are the medical background. It's going to be different in a young, but also it's going to be different in someone with all these different comorbidities. I mean that it's the ICU and then the post-ICU. And what is going to be my case or your case, we can't anticipate. Is again, we will probably respond in a different ways to the treatment and also to the admission. Now that's where in the post-ICU syndrome, it could be very complicated and sometimes worse than the ICU admission in the ICU itself.
And when you look at the vulnerable populations or the high-risk groups, I mean, we know our situation in Belize. Looking at it once again, I know it includes the elderly, people, we say with comorbidities, but they have other conditions, or diabetics or hypertensives. I know obesity is also a risk factor as well. What are some of the other high-risk groups that make us in Belize particularly vulnerable?
Well, we've seen in other countries that the people with obesity, they have different outcomes and worse outcomes in the ICU. Also, we see patients with asthma, with we call it COPD, or chronic obstructive pulmonary disease, that is divided in two. Is divided in patients with chronic bronchitis and patients with emphysema. That we have also the patients with diabetes, and also with patients with hypertension. As you see, also patients with, in Belize, we have an important population of patients with chronic end-stage kidney disease. And those patients with chronic kidney disease, the background is most of them diabetes or hypertension, on a combination of both. We have also a group of patients with immunological conditions, and when I call it immunological condition, I'm talking about rheumatoid arthritis, lupus, that in some cases, this group of patients are taking some medication that we call it immunomodulators, and those medications that are intended to try to control the inflammation also can make you vulnerable to get that we call it opportunistic infections, and of course COVID-19 is one of those. No? Patients with cancer, we have an important group of patients with cancer in Belize. Some of them are undergoing chemotherapy. Some others right now, unfortunately, due to the border situation, probably they need radiotherapy, but they are not able to access it right now. Yeah. But if you are in radiotherapy, also you are vulnerable. Mean that all those group of populations, we need to be very cautious and have an extra security measure of making sure that they are all the time adhering to the social distancing measure.
And have we also learned anything new about sort of the long-term effects after persons who have actually survived the virus, whether or not they've had a severe case or not? Are there any sort of complications or long-term effects that will, perhaps last much longer than the actual COVID infection?
Yeah, as I mentioned, it will the long-term effects we still need to learn, because of course we just have December not to now, and it's still even that is a couple of, say, 8 months, mean that we still to see what is going to happen, especially with those post-ICU patients that ended with pulmonary fibrosis, how long they will need to be on oxygen, how long it will take for them to, most importantly, how long they will take to incorporate to their economic activity, because you ended in ICU, and then after that, how many weeks you will be at home not able to produce, no? Unfortunately, yeah, but it's the reality. We need to see how our population can be incorporated to the economical activity as early as they can, because being in ICU for 3 weeks, you be put on the sedation today, you be probably fully sedated for a period of 1 or 2 weeks, and then suddenly you wake up and you realize that you are being admitted for those amount of time. Also, the other things in the mild to cases and to moderate cases, patients can experience tiredness, lack of concentration as one of the most important things. And the tiredness, it can last, it will depend. No? Again, we're still learning about the long-term complication, side effects, and symptoms that the patients can develop, and we're still tracking those. We don't have I think so we need to wait probably a year to see exactly and to understand more the side effects, the long-term side effects.
Well, Doc, we do appreciate you being able to provide us this information this morning, helping us understand where we are with vaccines, where we are with treatments. Just before we close, of course, we know we're looking at that big date next week, next month, August 15th, when the airport reopens. You are going to be at the helm at the KHMH. Just what's your advice to people? I'm sure, looking at preparations is one thing, but what do you say to Belizeans who are paying attention very keenly to what's happening in other parts of the world and very anxious about reopening up or border?
Well, this is a very complex situation, no? Because in a way, of course, we would like to keep ourselves as we are right now. But unfortunately, that in the other point is that at some point we will need to do the opening as we are doing it right now, because the opening is not going to be suddenly that we will have the same amount of flights that normally we have. Yeah. It's doing in a step by step, and of course many things they are putting in place to secure the medical community. We are on a continual medical education. This week, the last week, the Ministry of Health discuss with all the Belize Medical Society the different protocols. That way, everybody can offer an input. And I think so. this is something that is unique because, as you see, other countries, they are doing different things. And I think so, despite of our different things that we are lacking in the country, I think so we need also to recognize the good things, no? And we have been on continual medical education for more than since April to now, unstop. And then we discuss, and we are still discussing this week, the different ways, lab testing, we are analyzing mental health, we're analyzing the protocols for pediatric, for neonates, for adults, and then everybody have an opportunity to give the input. Of course, there are some that they have difficult to join the meetings, but we have an average between 80 to 100 people joining the meetings every day. And then they have the opportunity to give the input and say, okay, we can probably it's best if we do it that way. And then that's a very, really nice opportunity for the community to offer the input to the government, no? And also especially to the protocol. Now, as a community, we need to play our role, and I think so all of us, and this is not a general population, also as a medical providers, we have seen this with cautions and trying to make our preparations just in case we face an important outbreak. Again, there are many ways the ministry is preparing. They are building their own capacity at the airport to be able to test people up at the airport. Mean that and we as a society, our most important thing is we cannot relax. I think so. Right now is a period where we can exercise and strengthen our protection each other and the social distancing.
All right. All right, Doc. Well, thank you so much. We appreciate it, and stay safe.
Thank you. Same to you. Have a nice day.
And with that, we are going to go ahead and close off this segment, take a break, and when we come back, we'll be talking to the Belize Association of Planners. Please stay tuned.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.